So my name is Brenda. I'm gonna be asking you a few questions and doing your vitals so that you can be ready to see the doctor, okay?
Okay.
So can I have your name, please?
Cindy.
Okay. So first thing that you have to do is check on where it says visit status. So as of right now, it says that the patient is in the lobby, but right now we're doing intake. So I'm gonna change the status. So I will be changing it to intake, so that way the doctor and the nurse can know where the patients are. So I'll click OK, and then it will change. And then I click again on the patient's name, and I go to hub. And then here I can see if I have the right patient. So the name and last name and date of birth to see if that's the right patient. So I have here that you live at 60 Valley Street.
Correct?
And your date of birth is February 15, 1994?
Correct.
Okay. Okay, so then we go to progress notes. What's the reason for today's visit?
I have a really bad headache and a really bad stomach ache.
Is there something else?
That's it.
Okay. Okay, so once we get into the chief complaints, that's the first thing that we have to do. Once you go to chief complaints, it will be a box in the top where it says verified, but the only one that doesn't have that little box to verify is the chief complaints. So once you finish the chief complaints, then you will go for the next, which is medication reconciliation. And once you start with the medication, from the medication and the other questions, then they will have the box where it says verified. So after you finish asking the questions and put in all the medications, then you have to make sure that you click on where it says verify. Are you taking any medications?
I've been taking ibuprofen to help with the pain.
Like I said, like once we finish, we put verify and we click and we go for the next page, which is past medical history. Is all your medical history still the same, or there's something new going on, like you have diabetes, high blood pressure, cholesterol?
Just that my mom was diagnosed with diabetes is a new thing.
Okay, but your mom?
My mom.
Not you. So you don't have any medical condition? Okay, thank you. Any allergies to any medication or foods?
No.
No? Okay. Any surgery? Have you been in the hospital recently?
Last week I was in the hospital.
Alright. Were you like there for a few days, or was it just like
I was there overnight.
overnight? Okay. When was it?
Last Tuesday.
What was the reason for it?
The same headache, just that it was a lot worse.
Your family history. So we have here that your dad has diabetes
Mm-hmm.
and high blood pressure.
Mm-hmm.
And you mentioned that your mom has diabetes, right?
Yes.
Is there something new going on in the family?
Nope, that's it.
Your brother's still healthy?
Yes.
Okay. So right now we're gonna go where it says miscellaneous, which is the social history. And here we have like a few questions that we had to ask. We have the miscellaneous, the sexual history, the tobacco use, and the drug and alcohol. So we have to make sure that we ask those, go over all of them. So the first one will be the miscellaneous. Are you still exercising?
I am.
Okay. So you're still doing walking for 15 minutes every day?
Mhm.
That's what we have? Yeah, okay. And there is smoke detectors at home?
Yes, there is.
Okay. We have here that you're single?
Mm-hmm.
Okay. With whom do you live at home?
With my mom and dad.
Is there any domestic violence at home?
No.
No? Are you working?
I am.
Oh, you are. Have you traveled outside of the United States in the past 6 months?
No.
No? Do you drink any caffeine, soda, coffee?
Coffee.
Coffee. How many cups a day?
1.
Okay. Any pets?
A cat.
A cat. Okay. Last time you were that you saw your primary care doctor?
In November.
November? Was it here in the clinic?
Yes.
Okay. Any sexual abuse in the past? Do you feel safe at home?
Yes.
Okay, so that's it for the questions. So right now I'll be taking your vitals, and then after that you can go ahead and see the doctor. So I'm gonna start by doing your height and weight. Okay. So you can step up over here.
With shoes or no shoes?
It's up to you. Okay. So if you can please look this way. So I'll take your weight. Okay, you can sit down. Okay, so I'll take your temperature. So this will go under your phone and just close your mouth. Okay, thank you. I'll take your blood pressure. Let's see. Make sure to clean it every time that you're gonna use it. So, okay, so right now, prick your finger. I need to take a sample to see how your glucose is. Okay? So, I'll get everything ready. So I'll get a Band-Aid. I'll get an alcohol pad, make sure that everything is here. I'll get, okay, so what I do is I put gauze in the butter, so that way the patient, if any blood, it will go in through the gauzes, not into the mat. So first thing is ask the patient for the finger. Por favor. Is there any finger preferred for you to?
No.
No? Okay. So first thing I'm gonna do is, so I'll do the middle finger, and I will wipe it down with the alcohol pad. Okay. And then I will clean it because it has alcohol on it. Okay, so make sure not to do it like right in the middle, not in the sides where the bones are, because it's gonna hurt. So we have to do it not in the middle, but like here, right there. So first thing, so we squeeze it for the blood, we wipe the blood down, and then quickly we put this in here, and we'll go like this. Once it's doing that, then we can get the blood here from here. Okay, so what I do, I put it here, I wipe this down. Make sure that every patient gets a Band-Aid because it's really important, because it's an open wound. And also diabetes people, they need to have a Band-Aid on because they are at risk for any infections. Okay, and then we take this out, we put it here as long as this one. Okay, and so that's it. And then I'll pick everything up, everything that I used, I put it in my hand. I took off the glove, not touching the inside, and then I'll take this one out without touching the other one. So that'll be set, and they will go in the garbage. And I'll put another gloves. Oh, and before that, make sure to put the results in the system, which is 118. Okay. Make sure to wipe with alcohol the cucumber. Make sure there's no blood, there's nothing in here, and then you put it back where it belongs. Okay. And now I'll take your waist circumference. Okay. So you can come forward. Okay, so this will go your bone hips, that's hip bones here. Once you find it, you go around them, and to make sure, ask the patient where's the belly button. So it will be here, so it will be directly where the belly button is. So if you don't find it where the hip bones is, just follow by the belly button. So okay. All right. Thank you. You can have a sip. So last thing that we do is the pulse and respiration rate. So if I have a watch, I'll use my watch. I don't have it with me, so I'll use the clock in the computer. So what I prefer to do is I wait until it goes into the 30 seconds, and then I'll start from there. So I'll look for the pulse. And I'll start counting where it hits the 30 seconds. So what I did is I took her pulse, and while I'm taking her pulse for 30 seconds, the other 30 seconds for a minute, I'll be taking her respiration rate. So if I tell the patient that, okay, so I'll take your pulse and also I'm gonna take your respiration rate, then the patient will get nervous. So what I do is while I'm taking the pulse, I'm looking at the time, and then I'm looking like right in here, but not on her directly, the patient. So what I do is I'll take the pulse for 30 seconds, and I'm looking around this area. So once it goes to take the respiration rate, I'll just keep on thinking that the patient keep thinking that I'm still taking the pulse. When I'm finished, then I'll put in the system her pulse and respiration rate. So your doctor will see you in a few minutes. So if you can just step out, and there's like a little there's chairs outside. You can follow me. I can tell you where it is.
Thank you.
You can sit there. So now what we had to do is like go back to our research schedule. So you go back to where we can change, like I said, like in the beginning, we have to change the status of the patient. So I will go back and I click on the patient's names, and now I finish with intake. So we're gonna put that the patient is waiting for provider. If the patient is waiting for any vaccines, then we will put like the patient is waiting for the nurse. So it will be waiting for a nurse. But if the patient is waiting for a doctor, then we put it waiting for a doctor. And then we press OK. And so that way the doctor can know how many patients she still have. Okay? So after that, then I'll make sure that everything is clean. So we have to wipe up everything. We make sure that there is no blood around, because it's really dangerous. If there is blood in the mat or anything around here, then we just throw this one out. We put it in the garbage. Make sure to wipe down the table if there's any. Okay? Make sure everything is clean, and make sure that the cameras are clean as well, because they have blood. Put it back in. We have to always make sure that everything is clean. And here there's more blue mats that goes in here. So we just place a new one. We clean everything and make sure that the lenses and the strip, they go on the sharp containers. Make sure that they go there. Don't leave it out here as soon as you finish with pricking the finger, put it in here, and please make sure that no gloves goes in the sharp containers. If there's blood in the gloves, like I said, you just pick it from here, put it in, don't touch it with your hands, like this, and don't touch the glove, just touch it from the pattern, and grab it like this, and just put it in the garbage, not in the sharp container. Okay? And thank you.